Hello! Did you know that an isolated panic attack is not even a mental disorder? Also, did you know that a panic attack can be limited or complete? And one more thing to entice your curiosity. Did you know that there are quite a few types of panic attacks? Let's get right on it and learn all about it. Many people have 1 or 2 panic attacks in their lifetimes, but once the problem or stressful situation goes away, so does the issue with panic naturally. An isolated panic attack is not a mental disorder in a healthy individual. While a panic attack can manifest as a standalone phenomenon, it often presents itself within the framework of an established anxiety or mental disorder, or as a consequence of particular medical conditions. This includes, but is not limited to, 2 conditions like social anxiety disorder, specific phobia, post-traumatic stress disorder, and obsessive-compulsive disorder. In instances such as these, the occurrence of a panic attack is classified as a specifier, and it serves to provide a more comprehensive understanding of the individual's mental health status. For example, if an individual is already diagnosed with post-traumatic stress disorder and subsequently experiences a panic attack, the panic attack is categorized as a specifier of that disorder. This results in a refined diagnosis, exemplified as post-traumatic stress disorder with panic attacks. Alternatively, a person without any pre-existing anxiety or mental disorders who experiences repeated and unforeseen panic attacks and who lives in prolonged fear of future episodes may be suffering from panic disorder. This condition is characterized not just by the frequency of the attacks, but also by the persistent preoccupation with the possibility of their recurrence. Let's take a step back to define panic attacks and panic disorder better. According to the American Psychological Association, a panic attack is a sudden surge of intense fear or discomfort that peaks within minutes, and during that time 4 or more of the physical and cognitive symptoms described below occur: palpitations, pounding of the heart or accelerated heart rate, sweating, tremors or shaking, sensation of shortness of breath or smothering, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded or faint, chills or heat sensations, paresthesia, that is numbness or tingling sensations, serialization, that is feelings of unreality, or depersonalization, that is being detached from oneself, fear of losing control or going crazy, fear of dying. These symptoms, characteristic of panic attacks, can manifest in a calm state or, conversely, from a state of anxiety. Also, the panic attack can be considered complete with 4 or more symptoms, or limited with 3 or less symptoms. The causes that can influence the appearance of a panic attack are mainly the 4 mentioned below: genetics, high level of stress, a character more sensitive to stress and prone to negative emotions, modifications in the way the brain functions. In this context, a panic disorder refers to unexpected and recurrent panic attacks. That is, these can appear suddenly and continuously, and usually develop between the late teenage years and the age of 45. The course of this disorder is chronic, but fluctuating. The frequency and severity of the attacks may vary, as some people experience it once a week and others, for example, twice a month. The DSM-5 2014 outlines several factors contributing to panic disorder, including temperamental factors. A tendency towards negative emotions and perceiving anxiety symptoms as harmful can heighten the risk of panic attacks, especially with accumulated fear episodes. Environmental factors. This disorder is often linked to a history of childhood sexual abuse, physical maltreatment, and smoking habits, more so than in other anxiety-related disorders. Physiological and genetic factors. Some genetic predispositions may influence the onset of panic disorder, with the amygdala and associated brain structures playing a significant role, as they do in other anxiety disorders. The therapeutic approach for treating panic disorder aligns closely with that of agoraphobia, as we studied on this video on the top left, predominantly utilizing benzodiazepines, commonly known as anxiolytics, for their rapid symptom relief. However, it is crucial to mention the potential for addiction with these medications, as prolonged use can culminate in physiological dependency, intensifying distress upon withdrawal. Alternatively, antidepressants, including tricyclics and selective serotonin reuptake inhibitors, are employed, requiring a longer duration to manifest their benefits, but mitigating the risk of addiction. Cognitive behavioral therapy stands out as the predominant psychotherapeutic intervention, emphasizing gradual exposure to anxiety-provoking situations with support from professionals and family. This method extends to exercises that simulate the physical symptoms of panic attacks, such as hyperventilation or on-the-spot running, aiming to diminish the anxiety experienced in such scenarios. Here are 4 types of panic attacks along with examples, so the difference between them is very clear. 1. Spontaneous or uncued panic attacks. Attacks occur unexpectedly without a clear trigger. Can happen during calm or anxious states and not tied to specific situations. Examples: experiencing a panic attack while relaxing at home, during sleep, or while doing routine activities. 2. Cued panic attacks, consistently triggered by specific situations or stimuli, strongly associated with particular stressors. Examples: panic attacks triggered by public speaking, encountering a specific phobia, or being in a social situation. 3. Situationally predisposed panic attacks, more likely to occur in certain scenarios, but not inevitably triggered by them. Increased risk, but not a guaranteed response to potential triggers. Examples: a person with a fear of flying experiencing panic attacks during flights, but not every time they fly. 4. Situationally bound panic attacks. Almost always occurs in response to specific triggers, highly predictable based on the situation. Examples: panic attacks in response to seeing needles for someone with a severe phobia of needles. Understanding the nature and triggers of panic attacks can be a crucial part of developing effective treatment strategies. It's important to note that experiences of panic can vary widely among individuals. There can be variations in intensity, duration, and specific symptoms experienced. In conclusion, it's imperative to understand the complex nature of panic attacks and panic disorder, shedding light on their varying forms and impacts on individuals. Addressing these issues requires a comprehensive approach, integrating medication and cognitive behavioral therapy to alleviate symptoms, prevent addiction, and empower individuals to manage their anxiety. Through understanding, proper diagnosis, and effective treatment, individuals can absolutely regain control, reduce anxiety, and improve their quality of life. Thanks for watching. Like what you heard? Hit like, subscribe, and stay updated with our future lessons. Your feedback and questions in the comments section are greatly appreciated. Check out the links to recommended books in the description for more resources on psychology and overcoming panic disorder. Now, explore these great videos about fear and anxiety and understanding emotions. And remember, stay unique.